Dr. Korab. I'm a board-certified podiatrist, podiatric surgeon. I treat anything related to the foot or the ankle, from things as simple as toenail concerns to fractured ankles, reconstructions, and kind of everything in between. I grew up in Seattle. I've been here in Arizona since 2022. I'm married, I have 4 children. I went to school at Temple University in Philadelphia, and I did my residency in the Seattle area. And that was a 3-year residency, and that was focused fully on surgical treatments. I consider myself more of a general podiatric surgeon. I can really do anything comfortably. My typical start of the day, I usually print off the schedule. Shows me all the patients who are coming in that day. I review through the charts. What are they coming in for? Is it a follow-up? Is it a new patient? So it sounds like you've had a couple issues going on for a long time, yeah.
Mainly on the sesamoid and the plantar fasciitis.
Yeah.
I've seen a couple different podiatrists.
Okay.
Yeah, over several years.
Okay.
So yeah, I don't know. I don't know what else, if there's anything that can be done for this.
I just want a second look because I feel like it could be nerve related.
So I don't see any evidence of a stress fracture. So I agree, you probably started out with a contusion, maybe a bone bruise. It's certainly possible with the impact. But what happens in addition to the bone bruising is the soft tissues around it get swollen. And as that happens, you can often irritate a nerve. So we call that a neuroma.
Yeah.
Did you read up on that?
I did.
You did your, Dr. Google was correct in this case, okay? So I'm not sure that this is truly plantar fasciitis. Mm-hmm. I think you might have a nerve entrapment. So it's a condition we call tarsal tunnel syndrome. So it's kind of like carpal tunnel in the wrist.
How can you tell that?
I usually get an MRI. We'll see some changes in a couple of the muscles in the foot if it's tarsal tunnel. Mm-hmm. I guess I was introduced to podiatry when I was a teenager. I was playing basketball and I was having some Achilles problems. So my mom took me to a podiatrist and he was helpful. He diagnosed me quickly, came up with an effective treatment plan that got me better pretty fast. I ended up not missing any time, which was great. So I had a good positive experience with podiatry early on.
He's a great doctor, he's very patient. He allows me to learn a lot about what I'm doing, but also how to help the patients. He goes into the room, kind of discusses with them, and tells us what we need to do as far as setting up procedures.
He's a great doctor, all the patients love him. He's very caring, very thorough, takes his time, which the patients appreciate. Especially, he sees a lot of the older patients, so they love to have all that time.
A good work day, seeing a nice mix of post-ops, new patients with fractures, those are always interesting to see. I like doing some dermatology stuff too, so like toenail issues and warts and those types of things. So a nice mix of all that is, I'd say, is an ideal day. Yeah, it's hard to say if the nail was already a little irregular prior to the injury, but it's not super well attached, okay? So looking at it, you can see some dark spots to it, so there are definitely some areas of bleeding underneath the nail. Mm-hmm. And the bleeding there, the concern is that collections of blood are a harbor for bacteria. Mm. They tend to get infected. Mm-hmm. So often the best option for a toenail like this after an injury is actually to remove it and let a new one grow in its place. So I can do that for you right now if you'd like.
Oh, sure. Let's just do it.
Okay. Cold spray here. So now I'm just going to give it a moment to get nice and numb, and then David's going to set some stuff up for me, and then we will be back, and we'll take care of you, okay?
All right.
The staff is what makes this office special. Having good doctors is critical to having a successful practice, but if you don't have staff that is friendly, compassionate, and consistent, it really makes it hard. All of our staff is excellent. Allison is that initial face they see when they come in, and she's always so friendly and helps them feel welcome. The medical assistants are great at putting patients at ease if they're a little nervous, and they kind of set things up so that my day runs smoothly. They help keep me on time. And then even the back office staff, our insurance and our billers, our clinic manager, they all are so critical in everything that we do. This office really, everyone gets along well, which is kind of rare in any sort of office setting.
So are you guys? Be nice on film. I know you're recording.
It takes a team, it does, and it truly does feel like a team here. But they're all set up?
Yes.
Okay, thank you. All right. So if you feel more than pressure, make sure you tell me if you feel anything pokey.
that is pretty.
Questions for me?
Nope.
All right, you're all
Make it
set
work.
then, okay?
Thanks so much.
Yeah, great seeing you. Hello, sir.
How are you?
Not too bad. Yourself? This particular gentleman started developing pain in the back of his ankle last week. Progressively got worse to the point where he said he couldn't even put his pants on because it was so painful to stand on that one side. On his exam, he was painful over his Achilles tendon. He had some swelling, some warmth, which is consistent with an inflammatory process. I diagnosed him with Achilles tendonitis. Well, it's nice when you can feel confident in your diagnosis and in your treatment plan because you've seen it work. You've seen what the expected outcome is going to be. And it does come with experience. You know, after you've examined thousands of patients, you know where your anatomy is, you know, based on where their pain is, what's involved.
How tall are you, by the way?
I'm 6'7".
6'7"? Have you played basketball?
I did.
Okay, yeah, I figured.
I do still play basketball, yeah. Not as often as I'd like to. I play basketball in the mornings every so often before I come to work. In-office procedures, in-office cases, I love ingrown toenails because they are very pain relieving for the patient. You know, it takes care of something that often had been a chronic issue for quite some time, and it's nice that we can address it in one visit and they're happy with it, and it's often a permanent fix. I hear you have some toenails that are bothering you.
I do. So my big toes, they like to curve in.
Yeah, I can see that. What you're dealing with is this is a version of an ingrown toenail. So that curvature is called onychocryptosis. But basically what it means is because of the way the nails curve, they dig into your skin. Usually we'll do a procedure. It's called a partial nail matrixectomy. And so basically we cut away a portion of the nail, we remove it, and then we kill the growth cells so that part of the nail never grows back. If it's something that you want to do, we can take care of it for you today. If it's something you need to wrap your mind around, we can do it another day. But I will tell you, most patients, when they leave and then they start thinking about it, they freak themselves out and then they don't want to come back. So sometimes it's best while you're here just to do it, but it's really what you want to do.
Do you have time? I don't want to.
Of course, yeah. No problem.
Okay.
Do you want me to give you an excuse not to do it? I felt like it was a good day. We saw a pretty nice mix of new patients with varying complaints. You know, some of them were second opinions. They'd seen other doctors for issues that had been bothering them, one of them for like 4 or 5 years. And so, you know, we were able to diagnose them accurately.
May I ask how long you've been doing this?
You're actually the first one I've ever done. I watched a video on YouTube right before I walked in. Well, I hope that they feel that they received the attention that they wanted, that they were able to understand the diagnosis that they have, why they got the condition, and hopefully understand the steps that we need to take to help them get better, and that they feel like it was worthwhile for them coming to visit in the office today.
Hello! All right, let's get you checked out.
It's fun talking to my kids. Sometimes at the end of the day, they'll ask me, what kind of gross things did you do today? I get that question a lot. And sometimes it's fun to gross them out. And I enjoy that.